Health chiefs warned that vaccine top-up jabs were not being taken up as quickly as the initial doses were rolled out. As daily virus deaths hit a 7-month high of 223, one expert said the next peak could be as serious as the last. Sir David King, former government chief scientific advisor, added that the virus was rising to yet another peak. He said he did not understand why booster injections had been deployed extremely slowly after the swift rollout of first and second shots. It's very surprising, given the success of the vaccination scheme, which was conducted through the NHS in an amazingly professional way. I've had my booster, but I do know many older people who haven't. Ministers are so far sticking to their stance of not reimposing restrictions. But Downing Street aides said that the Prime Minister is keeping a very close eye on the rising rates of coronavirus infection. The daily number of fresh cases was the highest in 3 months at almost 50,000 on Monday. Yesterday a further 43,738 infections were confirmed, along with 223 deaths, the most in a single day since March 9. Health officials are also monitoring a subvariant of the Delta strain, A4.2. which made up almost 10% of all infections in England in the fortnight ending October 9. Number 10 aides insisted there is no evidence that it spreads easier. Professor Neil Ferguson, of the Scientific Advisory Group for Emergencies, SAGE, said it was critical that the rollout of boosters and first doses for teens is quickened. He warned that some curbs on society may be needed this winter. The epidemiologist said the public should be aware that we have currently higher levels of infection in the community than we've almost ever had, and urged caution, such as the wearing of masks. Professor Ferguson claimed it was very unlikely we'll see anything like the levels of deaths we saw last year. Coming into the winter there may be a Plan B which needs to be implemented, which involves some rolling back of measures, but I doubt that we'll ever get close to the lockdown we were in January. The government's COVID data dashboard suggests up to 8.7 million people in England are eligible for a booster, having had a second jab at least 6 months ago. But NHS statistics showed that only 3.8 million had received a top-up by yesterday. The total includes a small number of third, primary, vaccine doses for those people with weakened immune systems. See the latest COVID vaccine stats below and visit in your area for all the COVID vaccine latest. Amanda Pritchard, chief executive of the NHS, defended the pace of the top-up rollout and said there was plenty of capacity. She told the Commons Health and Social Care Committee that boosters had been administered at twice the rate of first doses last year. There is no delay in sending out invitations. Within days of people becoming eligible, they will get their invitations. But, she added, they are not coming forward as quickly when they receive their invitation as we certainly saw for the first jabs. Around 1.8 million more invitations will be issued this week. Ms. Pritchard continued, boosters really do make a difference in boosting immunity. If people get their invitations this week, or they've already had them, there is plenty of capacity, so please come forward. The government will this week launch the next stage of its winter vaccines publicity drive via TV and radio adverts. Writing in the Daily Express today, Vaccines Minister Maggie Thorpe says it is vital to continue the jabs momentum. It is so important everyone eligible for their jabs comes forward as soon as possible. Hospital leaders backed her call. Saffron Cordery, Deputy Chief Executive of NHS Providers, said that boosters were a vital step in maintaining our defences. She added, immunity levels dip over time. This means there is a continuing risk from the disease, especially for the most vulnerable. The number of COVID patients in hospitals in England hit 6,099 yesterday, the highest in a month, including 733 being treated in intensive care. Downing Street aides said the government was not complacent about rising cases. They added that hospital admissions and deaths were an order of magnitude lower than earlier on in the pandemic. The Prime Minister's official spokesman said that there were no plans to use Plan B contingency measures and stressed the importance of the booster program. Health Secretary Sajid Javid told MPs there was huge pressure on the NHS, adding, "We can all see this wherever we live. It is picking up over the winter, and usually winters are tough for the NHS, but this winter is going to be particularly tough. The pandemic is still ongoing, this flu season will be particularly tough." Mr. Javid said extra funds were going to the health service. "We are going to set out very shortly with the NHS a detailed programme for the winter and how we can better deal with the pressures." Health chiefs are also accelerating delivery of first doses for children aged 12 to 15 by letting them book an appointment at a vaccine centre instead of waiting to get the jab at school. Mr. Javid continued, "It is important for anyone who has been invited and who is eligible for a vaccine including young people that they do come forward and take up that offer." The research charity Blood Cancer UK today raised fresh concerns about the confusing rollout of the third primary doses for people who may not have a strong immune response to the jabs. It said analysis had found that 1 in 20 COVID patients in intensive care was immunocompromised, up from 1 in 30 earlier in the pandemic. Comment by Maggie Throup: "Our vaccine rollout continues to be a phenomenal success. So far, around 95 million doses have been given to those eligible. We know that every jab administered helps strengthen the wall of defense that our vaccines had built against COVID-19. It is vital we maintain this protection as we go into winter, which is why the booster program was launched. The aim has always been to help prolong protection and reduce infection and serious disease. At the same time, we are rolling out the largest flu vaccine program in history with more than 35 million people now eligible. I've recently had my flu jab and would encourage everyone else to get theirs. We know how serious both these viruses can be. They spread easily, they can lead to hospitalization, and sadly they can be fatal. Almost 4 million people have now had a booster or third jab in the first month of the rollout in England alone. That is fantastic progress, and we need to ensure that momentum continues." As well as being hugely grateful to everyone who has come forward for their vaccines, I also want to pay tribute to NHS staff and volunteers who have made the program the success it continues to be. All those eligible who have been invited for their booster can now either book online or by phoning 119. With the combined threat of flu and COVID-19 this winter, it is so important everyone eligible for their jabs comes forward as soon as possible to protect themselves, their loved ones and the NHS. Maggie Throup is Vaccines Minister.